Hello students and my dear friends. So in this session, we'll discuss one of the important central nervous system infection, that is encephalitis. What is meant by encephalitis? So what is meant by encephalitis? It is an acute inflammation of the brain parenchyma. So here encephalitis, it is caused by like different infections, like means different viruses, as well as very rarely like a bacteria and parasites. And there are other reasons also there for encephalitis, but most commonly it is caused by the viral infections. So viruses such as Japanese encephalitis, herpes simplex, cytomegalovirus, varicella zoster virus, like that. Like many viruses are responsible for the encephalitis. So most common origin is like viral infection. So then we'll see the term encephalopathy. So what is meant by encephalopathy? So it is the term which is used for the disease or damage or malfunction of the brain. So any condition which affect the like brain, that is called as like encephalopathy. So there are various causes are there for encephalopathy, such as infections like viral infections or bacterial or rarely like parasitic or fungal infections, and metabolic disorders. So metabolic disorders like which includes hepatic encephalopathy, uremic encephalopathy, and sometimes endocrine causes such as hypoglycemia or hyperglycemia, and sometimes electrolyte and osmotal electrolyte and other disorders, and inborn errors that may be like genetic. So these are all metabolic disorders. And sometimes drugs also causes encephalopathy. Like if you see sedatives and CNS depressants, anti-epileptic drugs, and some of the antibiotics and some immunosuppressive agents also causes the encephalopathy, and toxins. So toxins such as heavy metals like lead, mercury, arsenic, and industrial, chemical, gaseous, and environmental toxins, and even drug abuse. So they may causes the encephalopathy. And even prions also causes the like encephalopathy. So what is meant by prions? So prions, they are the like infectious particles. They are the like infectious protein particles without nucleic acid. They do not have either DNA or RNA. Only they have the like protein. So they causes neurodegenerative diseases. Next, meningoencephalitis. So what is meant by meningoencephalitis? So meningoencephalitis means meningitis with encephalitis. What is meant by meningitis? Meningitis means inflammation of meninges. So here meningitis along with the encephalitis. Meningitis occurring with the encephalitis is known as the meningoencephalitis. There is inflammation of the brain and its surrounding membranes. That is called as meningoencephalitis. Next, acute encephalitis syndrome, which means AES. AES means acute encephalitis syndrome. So what is acute encephalitis syndrome? It is a group of similar neurological manifestations, clinical similar neurological manifestations, such as there is mental confusion, disorientation, delirium, or coma, along with an acute onset of the fever. So here, what are the most common causative agent of acute encephalitis syndrome? Like viruses, bacteria, fungus, parasites, and chemicals, and some of the toxins. So they may causes the acute encephalitis syndrome. So among these, viruses are most common cause of AES in the India. Next, autoimmune encephalitis. So what is meant by autoimmune encephalitis? So it is a condition where the immune system attacks the healthy brain cells. So antibodies are produced against to like brain cells, and this brain cell, like these antibodies, they attack the like brain cells. So which leads to the inflammation of the brain. So these persons, which means those who are having like acute immune encephalitis, they have various neurological or psychiatric symptoms. So what is etiology? So here the infectious causes. So as we discussed, so viruses, they are the most common causative agents of encephalitis. So if you see what are the most common agents, like Japanese encephalitis, JE virus. So this is the most common cause of epidemics of encephalitis in India. And next, HSV virus, herpes simplex virus. So HSV1 is more common than the HSV2. And next, cytomegalovirus, CMV. So CMV virus causes like encephalitis in the immunocompromised patients. And next, varicella zoster virus, VZV, which is the causative agent of like chickenpox. And next, Epstein-Barr virus, EBV, and West Nile virus. So these are the most common causative agents. And even Nipah and Hendra viruses, so they causes the like encephalitis. And the rabies virus also causes encephalitis, but it is secondary to the dog bite. In case of dog bite only, so in case of unvaccinated persons only, they causes the like encephalitis, or otherwise generally they do not causes. And other viruses which rarely causes the encephalitis, what are those? Measles virus, rubella virus, mumps virus, and enteroviruses, and then like toga viruses. So toga viruses include Western equine encephalitis, Eastern equine encephalitis, and Venezuelan equine encephalitis. And next, flaviviruses. So flaviviruses, except Japanese encephalitis virus, such as St. Louis encephalitis, Murray Valley encephalitis, tick-borne encephalitis, they are the other rare viruses which causes encephalitis. And other causes, even bacteria, parasites, and fungi, they causes the encephalitis, but very rare. So in case of if you see the like a bacterial causes, like Chlamydia psittaci. Chlamydia psittaci, it is transmitted from parrots to humans. Very rarely it causes encephalitis. And Mycoplasma species, Rickettsia, and Bartonella. And fungal, such as Cryptococcus neoformans. So Cryptococcus neoformans causes meningoencephalitis. And parasites also causes like encephalitis very rarely, especially like Toxoplasma gonadi. So Toxoplasma gonadi causes infection, especially in case of HIV infected patients because they are immunocompromised. And Plasmodium falciparum, which is a causative agent of malaria, like cerebral malaria, it causes the cerebral malaria. And next, Naegleria flori. So it causes primary amoebic meningoencephalitis. So it is also called as a like brain-eating brain-eating parasite. And next, Trypanosoma brucei, which causes sleeping sickness in the Africa. So what is the pathogenesis? See, encephalitis, it can affect young children, old adults, and those who are already immunocompromised. So not only young children or old adults, so like anyone may be affected by this, like encephalitis. So what will happen? There is inflammation and edema, such as swelling, occurs in the infected brain areas, such as cerebral hemispheres, brainstem, and cerebellum. And sometimes spinal cord also may be involved. And encephalitis is a serious life-threatening disease. So if it is not treated, then it leads to the like death. And the most common causative agent is viruses, as we discussed. Next, clinical features. So symptoms that might be mild initially, but can become severe on over time. So what are the earliest symptoms? Such as generally patient complaints like high-grade fever, headache, and pain in the joints, and feeling sick. So these are the earliest symptoms, such as high-grade fever, headache, and pain in the joints, and feeling sick. And then after there will be like severe symptoms when the like brain is affected, such as symptoms such as we can see confusion, agitation, fits such as seizures, muscle weakness, loss of sensation, paralysis, and loss of consciousness. Next, laboratory diagnosis. So in case of like a viral encephalitis, suspected viral encephalitis, so what are the specimens generally we collect? We collect the like a CSF, cerebrospinal fluid. This is for isolation of the virus. And a blood sample is collected for detection of antigen or antibody. So by using of blood, we can detect either antigen or antibody, and CSF sample is for isolation of the virus. So CSF, it is collected by the lumbar puncture. So collection and transport. So as we are aware of that, CSF is always collected in the sterile and universal container that is done by the lumbar puncture under all aseptic condition. So strict aseptic condition should be maintained while collecting the CSF. So after collection of the sample, so transport the sample immediately to the microbiology laboratory, and it should be processed as early as possible. So if there is any delay, then we can refrigerate the specimen. And remember, so in case of suspected encephalopathy, which is because of the viruses, in that case only CSF can be refrigerated. Suppose if you are suspecting bacterial meningitis, so which may be caused by a Haemophilus or otherwise Streptococcus. So in that cases, we are not supposed to refrigerate the specimen because those bacteria are delicate. So they will die quickly at a cold temperature. So in case of suspected viral encephalitis, we can refrigerate the CSF. And the blood sample is collected. As we discussed, this is for antigen or antibody detection. So blood is collected in a plain vial by vein puncture under aseptic conditions. So next, direct examination. So direct examination of CSF is done. So this is done for cell count and biochemical analysis. So in the cell count, so total cells are increased. That is 10 to 500 per cubic mm. So predominantly lymphocytes. So there is increase in the lymphocyte count. And when we go for the biochemical analysis, so the total protein count that is slightly increased, the percentage is slightly increased, that is 62 mg percentage, and then sugars are normal. Next, antibody detection. So antibody detection, it is the mainstay for diagnosis of viral encephalitis. So these antibodies in the serum, they can be detected by ELISA, enzyme-linked immunosorbent assay, or immunofluorescence test. So in case of Japanese encephalitis, we can identify the specific IgM antibodies. Specific IgM antibodies detected. So by using of serum sample, we can detect in the serum sample by a capture antibody ELISA, MAC anti-ELISA. This is recommended method for the diagnosis, and even we can go for reverse transcriptase PCR, RT-PCR, reverse transcriptase PCR, and real-time PCR. So this real-time PCR, it is to detect the RNA of the Japanese encephalitis virus. Next, in case of HSV, herpes simplex virus, so specific IgM antibodies found that can be detected by using of ELISA, and even we can detect the herpes simplex virus DNA by polymerase chain reaction and real-time polymerase chain reaction. And in case of cytomegaloviral infection, so specific IgM antibody can be detected by ELISA. And in case of varicella zoster virus, so specific IgM antibody is formed that can be detected by using of ELISA. And in case of West Nile fever, we can detect IgM antibody in the serum or CSF. That is also done by ELISA. And in case of Epstein Barr virus, so specific IgM antibody that can be detected by ELISA, and even we can identify by Paul Bunnell test and monospot test. And in case of measles and in case of mumps also, a specific IgM antibody that can be detected by using of ELISA. Next one, isolation of virus. So generally, as you know, for growing of the viruses, generally we use a tissue cell lines. So tissue cell lines, they are for used for growing of the viruses, such as we can grow the herpes simplex virus, varicella zoster virus, cytomegalovirus, mumps virus, measles virus by using of the tissue cell lines. So these facilities are not routinely not available. And next, we can detect antigen. So even CMV antigen, cytomegalovirus antigen, they can be detected from blood leukocytes by using of monoclonal antibodies. And EBV antigen can be detected by using of monoclonal antibodies. Next, molecular methods, PCR. So polymerase chain reaction, this is for identification for several viruses. And electron microscopy. So herpes viruses, they can be identified by using of electron microscopy. They can be demonstrated under electron microscopy. And even we can go for fluorescent antibody test. So this is used on the brain biopsy specimen for herpes simplex virus detection. So it is to detect antigens in the rabies virus in the diagnosis. Next, in case of bacterial encephalitis, so we can detect the antibody in case of chlamydia and mycoplasma species. And even we can detect the mycoplasma and chlamydia by using of a polymerase chain reaction. Next, parasitic encephalitis. So in case of parasitic encephalitis, we can detect the Toxoplasma gondii by antibody detection. So specific antibodies can be detected for Toxoplasma gondii. And in case of Plasmodium falciparum, so as we discussed, it causes cerebral malaria. So for that, we can demonstrate the like a parasite in the peripheral blood smear. So demonstration of parasite in the specimen. So it is like a diagnostic feature, key diagnostic feature for most of the parasites. Next, in case of fungal encephalitis, so as we discussed, Cryptococcus neoformans, this is the only fungi which causes encephalitis. So that can be grown on SDA medium, Sabarus dextrosagar media, or it can be grown on even BHI broth, brain heart infusion broth. So that is for isolation of Cryptococcus neoformans from the CSF. And even we can identify by India ink preparation because it is a capsulated fungi. So this capsule can be identified by using of India ink preparation. So it is to demonstrate the Cryptococcus neoforms in CSF antigen, and even by latex agglutination test also we can identify. Thank you.